My name is Darius Carter, and today I'm going to be discussing the differences between Medicaid and Medicare in the state of Florida. So, Medicare is for people mainly 65 years and older who have either retired or about to retire, who also need health insurance because most of the time jobs offer health insurance and health care, and so you're able to get that care through your job, through their insurance. However, this is why it covers these people that are 65 and older. It also covers people with disabilities and stuff like that. It mainly goes for like doctor visits, overall care, but it doesn't pinpoint stuff like vision, dental, all that kind of stuff like Medicaid does. Now, in one of the videos that we had watched this week by PIH Health, it talked about the three different types of healthcare that you can get, and I wanted to look at this real quick to remember the acronyms. HMO, which is Health Maintenance Organization, PPO, which is Preferred Provider Organization, and POA, which is Point of Service. I wanted to dive into that a little bit to talk about the personal provider organization and how you get to choose. So that means that you're choosing what healthcare insurance and what healthcare providers you're getting based on what you want. So that's your personal opinion, what you personally would want to garner from this healthcare situation that you have going on. And so I thought that this was a lot different than what we are going and diving into between Medicaid and Medicare, because you're not really choosing the healthcare provider that you're getting when you're with Medicaid and also Medicare. So Medicare is, like I said, with people age 65 and older, but also people with various disabilities who may not be able to take care of themselves, who can't pay for it, afford it, stuff like that. Now, Medicaid is for either pregnant women, children, people with disabilities who cannot afford their health care, and so the state overall will provide it. This is not done locally, it's not done personally, but it's done statewide. So the statewide insurance would be either Medicaid or Medicare. Medicaid, like I said, older people 65 and up. Medicare is for people age 65 older, disabilities. Medicaid pinpoints stuff like I said earlier, you have dental, you have vision, hospital visits, stuff like that is going to be covered under that type of insurance. This is because that's not covered in the other insurance, and so you're able to actually get what you need, because some people who can't afford to go to the doctor, like we talked about this last week, some people literally won't go to the doctor in the hospital because they're scared they can't pay for it. They're scared about the stress of medical bills, because that is a really true stressor when you're in like sickness and in health. Like, you're not going to want to go to the doctor if you can't afford it. It's not fair to those people. So that's why I wanted to add that in, because it's just such a big stressor. So that's one of the things that are like mainly pinpointed. Florida administers Medicaid, like I said, statewide, because there's a lot of people who are growing up poor who can't get their own health insurance, and so when this was implemented, it helps regulate the rules and like helps people get into the doctor when they need to. It helps pregnant women with their birth of their child. It just helps a lot more, and it also takes a lot of stress off people's plates, because some pregnant women before, I'm sure they wouldn't want to go to the hospital to have their baby because they couldn't afford that. It's very, very expensive to have a kid, especially in Florida. Florida is a very expensive state. Taxes are higher than, at least I know, Indiana. And I know medical bills are really expensive out there. A personal story I had that kind of relates with this is my health care. I have Medicaid, but I live in Indiana, obviously, and I hurt my shoulder very badly down in Florida on a trip with my family. I was doing something stupid, and I had dislocated my clavicle from my collarbone, and my insurance at first didn't want to cover over statewide, and this is because, like I said, it's between state to state, so it's not local, it's not national. Each state has their own Medicaid and Medicare plan, in that PIH video we watched, the PIH Health, it talked about the Affordable California Act, or the Affordable Care Act, but it was like the healthcare was called Affordable California. This was their own version of Medicaid and Medicare for that state. So like I said, just to end it all up and to wrap it all up, Medicare is for people aged 65 and up, with also including people with disabilities. And it doesn't cover stuff like dental, vision care, and other necessities that people might need. However, Medicaid will cover your dental, your vision care, pregnant women, even children, and also older adults given their financial situation. Financial situation also has to do a lot with how you get this. So if you're able to have enough money to be able to choose what healthcare provider you get, or you're getting one through your job, they're usually going to want you to use the one you have before you go on to the one that's essentially free. Thank you for listening.